Do you have a lived experience that could benefit the work of a public health program or initiative? Well, before I continue, let me first tell you what a lived experience is. A lived experience is personal knowledge about the world gained through direct, firsthand involvement in everyday events rather than through representations constructed by other people who may have never experienced those things. It may also refer to knowledge of people gained from direct face to face interaction rather than through technological mediums such as images and videos that, again, people who never experienced created. So, to put things in perspective, I will provide a real world example by sharing my lived experience and how I used it to benefit programs and initiatives in public health. So, growing up, my family and I lived in a low income area that was also considered a food desert. And on top of many other factors, transportation issues made it challenging to get to the grocery store and to work. Fast forward to my career in public health and working as a chronic disease health educator, I had the opportunity to provide insight from my lived experiences to help the organization conduct community outreach and build capacity with stakeholders and communities to improve infrastructure, access, and community health outcomes. Now, I love everything about public health and health education, and I think it's super important for you to share your lived experiences if you feel comfortable. I want to share the model I live by and run my business by. Improving outreach improves outcome. When outreach is improved and intentional, it improves the health outcomes of communities. So if you work for an organization or you're a volunteer or a member of an association or a board, let your team know about your lived experiences if you feel comfortable and how it can be used to improve outreach efforts and build trust in communities, eliminate hesitation from behavior change, and improve health outcomes. If you want to learn more about ways to improve outreach, leave your questions about your public health wellness program in the comment section. Provide content suggestions and comment below. Thanks for tuning in.